Hello amazing mama, and welcome to your first session of core and pelvic floor. Now you may be thinking, especially if you're in that first few weeks and months after your C-section, you may be thinking, what the heck, I can't do core work. But what I want to encourage you, it's not about engaging and squeezing and contracting your core muscles, but it's about reintroducing the function and the movements themselves that are going to lead to you learning how to contract them again. So go gently, follow the instructions, take your time. Everything is gentle. There's no pushing or squeezing or forcing your body to do things in this first phase. It is going gently. And when it comes to our pelvic floor is part of our core. So you've got your diaphragm on top, you've got your pelvic floor underneath, and you've got all the other intrinsic core parts in between there. And so because we've been pregnant, our pelvic floor has had the extra weight pushing down on it. So it's a little bit weaker than what it was pre-baby. And because we've had a C-section, for some of us, our pelvic floors aren't as affected as what it would be in a vaginal birth. However, we still have those hormones that have been involved and can make things a little bit loosey-goosey, good old relaxing. So what we want to do is learn and teach this muscle to engage and to strengthen again. So again, the movements that we do about drawing up and lifting our pelvic floor and reintroducing those functions again if we've got out of the habit or if we haven't introduced them yet. So again, go gently, breathe, take your time, and in time to come, yes, you will be back to doing normal exercise, but right now it's important to lay those correct foundations. So be mindful of your movements, go gently, and I look forward to doing this with you. See ya. So we're going to begin by laying on our backs with our knees bent, feet flat on the floor, hands down by your side. I just want you to simply breathe in and breathe out. Again, take a breath in and breathe out. I want you to think about relaxing your neck, relaxing your spine, relaxing your hands, breathing in and breathing out. I want you to put one hand on your lower belly, one hand on your chest. And as you breathe in this time, I want you to become aware of where you feel it. Whether you feel your chest rise first or your belly. And breathing out. We want our belly to rise first, so breathing in and breathing out. Next breath in, I want you to focus on breathing into your belly. So breathing in, let your belly rise. And gentle breath out. That's it, allowing your belly to rise first, breathing in. And breathing out. Continue in this pattern at your own pace, slow, steady, deep breaths. Breathing into your belly, belly rises. Breathing out, the belly falls. Again, think relaxed neck, relaxed shoulders, they can start to tense. And at no time are we going to be squeezing and contracting our core. This is far too early for that. We're just, particularly if you're in that first few weeks, even in the first, beyond that, in that first phase, just breathing into the belly and breathing out. What we're wanting to become aware of is the pattern of breathing. You inhale, your belly should lift. Exhale, belly should lower. Now what we're going to do is we're going to breathe out, and when we breathe out, we're going to focus on our rib cage dropping down. So instead of breathing in and letting our rib cage flare, our back should stay connected, and we breathe out like you're blowing out a candle, allowing your rib cage to naturally drop. Again, breathing into the belly and breathing out, feeling as you exhale all the air out, that rib cage drop. Now when we've been pregnant, our rib cage expanded to enable our belly to grow. And now we're trying to retrain it to go back to where it was before. But again, it's all very gentle. So breathing into the belly and breathing out, allowing that rib cage to drop. And now with this breath, I want you to keep that rib cage down And see if you can breathe more into the belly without letting the rib cage lift. So breathing into the belly and breathing out this time with a like you're lulling your baby to sleep. I did a lot of the sound. Breathing in into the belly and just a gentle Keep going with that pattern. When you're breathing out, you'll start to notice that as you get to the end of your breath, again, your rib cage is nice and low. So again, breathing in and breathing out. Breathing in, you're almost there. And breathing out. Okay. Going to move into that gentle pelvic tilt. So remember going to the arch in the back and then flattening it back again. Arch and flatten. Again, hands on your hips and just gentle. So inhale as you arch. Exhale as you flatten. And it's not a harsh movement. You're not trying to really pound it into the ground. It's just nice and gentle. Breathing in and breathing out. It's the beginning phases of what your core will start to do and what will build on. So again, it's just that initial, it's learning that connection of the movement, and in time to come, we'll introduce more. But for right now, in this first stage of phase one, want to be nice and gentle, breathing in as you arch, breathing out as you tilt. Breathing in and breathing out. Okay, now we're going to move on. We're going to move on to our pelvic floor. Now remembering we're going to lift like we're drawing up a blueberry through a straw. So breathing into the belly. And as you're breathing out, you're lifting and drawing out the pelvic floor. Breathing out. And our goal is to hold. Keep breathing in and out. This can feel a bit weird, but try and relax the rest of your body, your neck, your shoulders, your feet. Hold it for as long as you can. And then relax. Take a breath in and breathe out. Making sure your pelvic floor is fully released, and then breathe in again. And as you breathe out, lift that pelvic floor up, breathing out. Lifting it up high, 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 or otherwise going up like an elevator, up to the top floor and holding, keeping on breathing. Initially, when you're first starting out, it might feel more like a flicker, not much of a contraction. It's like it's not wanting to do it. That's okay. Go for as long as you are able to, and when you can't do it anymore, then take a breath in and breathe out and relax the pelvic floor again. Okay, for this next one, we're going to try and contract and relax our pelvic floor as many times as we can in this next 30 seconds. So when you're ready, take a breath in. Remember to breathe throughout. And off we go. Contract and relax, breathing as you go. That's it. You might have to really focus initially, depending, especially if you have pushed and you had some active labor before you had your C-section, then you'll find that there's potential for your pelvic floor to be a bit weaker. That's it. But for all of us, we've been pregnant, we've carried a baby, our pelvic floor has gone through a bit of work and the hormones, so we want to make sure we're strengthening it. Breathing in and out as you go, and relax. Now in this next stage, we're going to take a breath in. We're going to use the pattern of our breathing with our pelvic floor. So breathing in, relax the pelvic floor. And breathe out, lift that pelvic floor. Drawing it up, 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 up. And breathing in, relax the pelvic floor. And breathing out, lifting that pelvic floor, drawing it up, 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 nice and high as you can go. And then breathing in, relax the pelvic floor. And breathing out as you draw up and in, lifting, drawing in and up, almost like you're zipping up your pair of pants, lifting and drawing it up. And relax, breathing in. Remember, breathing into the belly and breathing out. Almost there. And take a breath. All right, very, very final movement. Bring your heels towards your glutes, your butt muscles, lovely. Sitting on the ground, take your hands down by your side for support. And we're gonna do a mini bridge lift. And I mean mini. You're not doing a full bridge lift all the way up. We're just gonna literally gently tilt the hip, so tilt the pelvis, arch the back, flatten the back and breathe out and just gently lift off the ground, butt off the ground and go back down again. Breathe in, slight arch. Breathe out, flatten the back and gently just lift it off the ground and back again. Again, go slow, go gently. There's no points for rushing. If anything, it's the opposite. And breathing out and lifting. Again, nice and gently. Use your hands to support you. Breathing in and breathing out and lower. Breathing in. You're doing wonderfully. You're almost there. Breathing out as you lift and relax. Yay! You've done it. Well done. Congratulations. Be very gentle when you come to stand back up again. So gently roll to your side using your hands for support and bring yourself up. Really important that you don't just do any sort of sit-up movements, especially in this first phase of training. As you're allowing your muscles to heal and your incision to heal as beautifully as possible. And we don't want to put any pressure or any strain on that area, so we want to be gentle. So using the side roll and using your arms to do most of the work. I know it can be painful, especially in that first period of time, so just be really gently. And if you're in the first few weeks of your C-section, really encourage you, set alarms on your phone to remind you when to take your pain medication. You really want to keep on top of that because that will help you to be able to rest more, to be able to gently get around and do the things that you need to. But in particular, it's a lot harder to get back on top of the pain levels when you've already let them go. So put alarms on your phone, take them at a regular time and go gently. Allow your body to heal, and I'm really proud of you today. I look forward to seeing you in our next session. Go gently. Bye.